Good afternoon. I'm Maureen McMahon, an epidemiologist with the Knox County Health Department. Today we're going to talk a little bit about contact tracing processes here. We know some folks are visual learners, so we will be using a whiteboard to try and illustrate how this process works. Let's start at the beginning. First, someone gets tested for COVID-19, and that comes back positive. It's important to note that results are coming back about an average of 2 to 3 days across the county. Typically, cases are notified of their positive result by the provider who tests them. The result is then reported to public health by the provider, lab, or hospital. Once again, this time frame can vary. Once that positive report makes it to public health, we or the Tennessee Department of Health will call or text the individual and initiate a case investigation. That means we ask where they've been and who they've been around in order to determine where they may have been infected or who they could have passed the virus to. These individuals are then given guidance about isolation. Now to contact tracing. There are 3 main components of contact tracing. The first is the case investigation. This is what we just told you about. It's where public health speaks to a confirmed case to identify any close contacts that they have. The second component is notifying those contacts. The Tennessee Department of Health assists KCHD and other regions with contact notification. If complete and accurate information is shared during the case interview, TDH will notify close contacts by either a text or call to let them know that they have been exposed to COVID-19. Teams are working 7 days a week, so you could get a call or text on Saturday or Sunday. From there, guidance about next steps is shared. Next week, we'll explain more about quarantine guidance, but in the meantime, you can find the guidance on our website, covid.knoxcountytn.gov, under the Prevention and Support tab. The final step in the contact tracing process is contact monitoring. This is also performed by the Tennessee Department of Health. Public health team members with TDH will reach out to contacts daily for 14 days to check in and see if any symptoms have developed. As you can see, there are a lot of factors in this process, and with the rapid increase in case volume, it can take time to work our way through this process. This is especially true if we can't get a hold of individuals or information isn't shared with KCHD to effectively perform contact tracing. We can only execute this process with the information that we have. That's why we urge everyone who is a positive case to immediately reach out to their close contacts and inform them that they have been exposed. That way these folks can immediately take action instead of waiting for a call from public health. The bottom line here is that the process involves multiple layers, and with a rising caseload, it can take time for information to make its way from the lab to the provider to public health to the contact. Please do your part to inform your close contacts of their exposure if you test positive for COVID-19. And if someone from KCHD or the Tennessee Department of Health calls you about your positive test result, please share the necessary information with us so we can help stop the chain of transmission. As we said before, we can only operate on the information that is provided to us. It's also important to note that the health department is onboarding additional contact tracing support staff as quickly as possible, but this community-wide spread of COVID-19 is outpacing these efforts. So even with the additional team members and new processes, when we see hundreds of new cases each day with their own groups of close contacts, it's simply not sustainable. So please use that layered mitigation strategy. Getting vaccinated, wearing a mask, physically distancing, and staying home when you're sick to protect you and those around you. This will help reduce the burden of disease in our community and the strain on the systems that are trying to help. If you have any questions or want to verify that a call or text is coming from public health, please call our public information line at 865-215-5555. Thank you, and please get vaccinated and follow CDC recommendations to keep yourself and those around you safe and healthy.